It's 14 minutes after 7. This is the AM show on Joy News on Multi TV. Well, we've been hearing about choices lately in music. We've had different covers of choices, but really today we are talking about the choice to either get pregnant or not, to decide as a woman, as a couple, when to get pregnant. And we'll also talk about how these choices affect population growth and development. Victoria Obiniwa is a public health nurse with the Adenta Municipal Health Directorate. She'll be joining us with that conversation. And Joyce Ami Amedo is the head of reproductive health unit with the National Population Council. It's a real pleasure to have you here.
Nice.
So how is Ghana doing in terms of our patronage of contraceptives, if I may put it?
In terms of patronage, I think Ghana has made a slight improvement, up to 22.2% of the married women using contraceptives.
What about those who are not married?
A few are using it because the unmet need is high. 1 out of 3 women, and then that's married women, and then 3 out of 5 adolescents pregnancy are unplanned, and they want to, delay or avoid pregnancy altogether, but they are not using any contraceptive.
And do you know why? Have you spoken to them, some of them, a couple of them?
A couple may talk of some of the time the myth and misconceptions that are attached to the family planning. Then it means, then maybe I will not go for it. But most of these pregnancies also end up in abortion, be it unsafe or going to the hospital. And at the end of the day, the unsafe one, most of them die, contributing to about 20 to 30% of maternal mortality.
Okay, so for you, it's better to prevent it than to get pregnant and try to terminate and die in the process.
That is it.
But you're with the National Population Council, and I'm sure this is very dear to your heart. I can see from your face. But really, how does this relate for you as a member of the National Population Council in managing or convincing people to use contraceptives in our development?
Well, the National Population Council aimed at managing the population of the country. And one of the key things to use to manage the population of the country is family planning. So our desire is to increase the uptake of family planning.
And how do you intend to do that?
Through the various implementing partners. For the public health and public service, for instance, we have the Ghana Health Service. There are other NGOs and INGOs, CBOs also implementing family planning activities. So we mostly is in the situation of coordination, but we coordinate all the activities of the other implementing partners. So Ghana Health Service is doing its work. The other NGOs, you have the PPAG, you have the MSI, the Maristopes, and other institutions that are also operating in the same area, also trying to encourage people to use contraception through BCC activities and also the service delivery aspect, giving information to people. Even when you go to the GS, for instance, in schools, they are told, they are taught about basic, not really family planning, but how to manage population and all that. So it's like targeting various people, different caliber of people at different points, at different areas, in order to increase that uptake of family
Okay, so
planning.
I'm a young man or a young woman.
Yes.
I'm married. I want to have 7 children. I can take care of them. I want to have them within an interval of 1 year. I have money of 1 year, sorry. I have money. I can take care of them. Why should I be considered about, the total development of a nation? If the nation doesn't want to develop, fine. But I'm developing as an individual. Why should it concern me?
Well, it should concern you because as an individual, you don't live in your own space. You share facilities and resources with other people. Family planning, if you don't, you can't even have children within 1 year. It's advisable that you space your children, preferably 3 years interval. And that makes the woman safe. Because the more you give birth at a short distance and even to too many children, it has effect on maternal mortality, and so the woman can risk her life in giving birth.
So I can't imagine someone looking back and saying, my grandmother had 11 children and she's still alive.
But times have changed.
Okay.
Times have changed. And then as a country's development, when you want to give birth, you go to a facility, a health facility. You don't give birth in your home. So you are using the facilities that are provided by the government. You go to school, your children are going to school, they are also using the facilities that have been provided by the government or the community.
What if I don't go to a government school? I'm in a private school. I go to a private hospital. I live a private life. I have the money. I can take care of my children.
It's not all about you as an individual, because you live within a community. You live within a nation. So whatever you do has implication on the entire nation or the community. It's space. If you have all the money and you are occupying certain space, you use the roads, you use every amenity that has been provided. And so it's of constraint to the country. And the resources, you know, every nation has limited resources. And when population is also growing, it should grow in relation to the socioeconomic development. So if we keep on having too many children, the population keep on growing. Currently we are 2.5. We grow at 2.5 annually, which is quite high. So level of economic development is also not growing that fast.
Now, someone could suggest that's the fault of the leaders. The leaders should be able to study the trend and know that we are growing at this rate, and so we must develop at that rate. Is it not a mistake?
It's not that easy. It's not that easy, because you are developing. You're building the schools, you are building the hospitals, you are building roads and all. But as you building, then the population is also increasing. So it becomes difficult to match up. It's limited resources that we are using. And so we have to develop, it has to go hand in hand. One shouldn't go for the other. And that is why we have a lot of unemployment and all that in the society. Okay. Because the resources that we're supposed to save in order to develop other sectors, we are not saving that resource. And we are just putting in certain areas like health, education, and all, and it's taking up everything. Forgetting about food security, because you need to buy food. There's supposed to be land for people to produce. The agri sector needs to also be supported in order to produce enough to support everybody in the country. And so if we just use our resources for only certain sector, leaving the others, then we'll always have problems.
Okay, so let me come to you, Vic. You deal with people who have to make all these choices every day personally. What are some of the myths? One of it, well, I don't know whether to call it a myth or not, but I've heard a lot of young ladies say, after taking the injectable, I put on this number of pounds, or I put on that number of pounds. But is it true? I mean, because I don't want to look any bigger than I am now. So if I have to use the injectable and I have to grow big, then I wouldn't use it.
And then can I ask whether you are still the same as 10 years ago?
I have lost weight, actually.
Yeah. Okay, that is, maybe you are conscious of whatever you want to achieve or aim at. Yeah, you put in a little weight, but it's not much. It's about 1 to 2 kilos. Yeah, because you are free thinking about unplanned pregnancy, what happens, or its consequences. So once you are free-minded, automatically you put on a little weight. Then let us look at the food that we eat, and at what time. After 6, that is when we are going to eat our heavy food. And after eating, you are even tired throughout the whole day. So what happens? Immediately after eating, you go to bed. So what happens to the food? It is stored as fat.
And so you're saying that if I use the injectable or any other form of contraceptive, I'm not going to put on
This is what I'm saying, that you put on a little weight. That is what I said, from about 1 to 2 kilos that you put on. Why? Because you are not thinking. Because even thinking about things can even bring you down. But now you are free-minded. You are free to have sex at any time that you want, not thinking about unintended pregnancy.
So let's talk about this, and this is something a lot of people share when we discuss issues of contraceptives. aren't we promoting promiscuity? Some think that, well, for me, growing as a young girl, it was really difficult to come by a condom. But nowadays, you just need to walk into a pharmacy, and if you are too shy, you just, find a way of selling the pharmacist that, I want this.
Yeah.
And some think that the call to have women use more contraceptives is promoting promiscuity.
It is not true, because even without it, people are still doing it. We think,
but you're giving them the freedom.
It's not the freedom, because what about it's a choice that you will make. But what about the death? Those who die out of unsafe abortion, because normally they will go in for it. Formerly, we were not having the education. I don't remember even our school, somebody coming there to talk about sexuality to us. But now we have the nurses going around, and so they are even doing it. Let us look at these statistics. Last year, 10 to 14, we had 2,722 of our youngest getting pregnant. At 15 to 90, we had 111,884. Then 20 to 24, we had 237,711. So from 10 to 24, we had 351,317, which is about 37.2% of our total antenatal registrants. That was for last year alone. What about those who went in for abortion, those who died out of it? Because unsafe or abortion contributes about 20 to 30% of our maternal mortality to it. So should we allow our young to die? These statistics, how many will even go to school? How many are working? So it means they are all going to depend on those working, and it is going to put pressure in the family as an individual, in the community that they live in, and in the nation as a whole.
Okay, so in concluding this conversation, Joyce, do you suggest we go the China way? Let's tell people you are allowed to have only 2 or 3 kids. Would that, because this obviously it's personal, it's a choice. You can't force it. You only need to advocate for it. But since you claim, or you're suggesting that it's really one of the major factors for underdevelopment and not being able to match the population with what we have to provide as a country, do you think that's the way to go? A law, so if you flout the law, you're punished?
No, I don't think so. We haven't gotten there. China had a population control program. We are having population management. And that is why we are educating people. We try to speak to them, to convince them, to weigh the consequences of their action. So
in all your education, have you seen an improvement then?
Well, as she said, recently there has been an increase upwards. The country was performing, we were going up, and unfortunately, we use the DHS mostly to assess our performance, the Demographic and Health Survey. And so we went up, and unfortunately, we dropped down in 2008. We've come back up again slightly, and that is also because recently our promotional programs went down, the demand creation programs went down, and so it's coming up again. And we believe that as people hear more and the benefits of using family planning, then and also using their practical things to speak to them, it will encourage them to use family planning.
All right.
Yes.
Thank you so much, Joyce. Thank you. Well, it was quite an interesting conversation, but we'll have to wrap it up here. You heard Victoria Obenua, and she's a public health nurse with the Adenta Municipal Health Directorate, and Joyce Ami Amedo, who's the head of reproductive health unit with the National Population Council. And we'll take a quick break. When we come back, we'll be talking AM business. The digital economy, is it the way to go? We'll be back shortly.